Angina pectoris is a term used to describe pain in the pectoralis muscle, either on the left or the right, and that pain can travel into the shoulder, into the neck, and across into the sternum. Hi, I'm Dr. Peters with Peters Wellness, Chiropractic and Massage. In this week's quick video, I want to discuss cervical thoracic angina pectoris, which is where someone who's having these chest pains should absolutely get things checked out. It should never be ignored. It could be a sign of a heart attack, a myocardial infarction, and we want to make sure that the person's heart is functioning well. Once someone gets that clean bill of health, now we want to look at the other possible causes of this pain. And with cervical thoracic, cervical just means the neck, and thoracic is our rib cage area from T1 to T12. This whole rib cage area, ribs move up and down. And when we look at the possible causes of chest pain, so you could have muscle strain. You know, if you were lifting heavy or maybe you slept wrong, you could strain your neck. You could injure the pec muscle area. The other thing would be vertebral subluxation, or the vertebrae in the spine where they're not moving and gliding like they should. That could lock up and actually radiate pain along the rib. So it could actually come around and be coming from the back. Or it could be the rib isn't moving properly against the sternum in the front, and that can cause pain to radiate around the back or up into the neck. Also, neck subluxations could travel down into the rib and chest area also. So the key here is making sure the heart is functioning okay. And reality of that is go to a medical doctor, see a cardiologist, and make sure. And they can do stress tests and different things. On the chiropractic side, and the other thing too with this is someone could have a heart condition and they could also have a rib, a sternum, or a vertebral issue or a muscle strain at the same time. So it's very important to get both things checked out. But if you know someone who's had it checked, everything's fine, but they're still having some issues, chiropractically, we can check these things out and make sure the ribs are moving properly, make sure the vertebrae are moving properly, and make sure the muscles are testing well. So if you know somebody who's suffered from this, number one, it can be really scary because, you know, if you think of anyone having a heart attack, what do you think of? They grab their chest, right? Or they may have pain out into the shoulder and arm. And this can be very, very similar and hard to differentiate. So just something to definitely never ignore. And if you know someone who's been checked and cleared and they're saying, hey, their heart's functioning well, then we're going to lead to a musculoskeletal issue and a nervous system issue, and look at that and clear that out. So if you know anybody who's had that or in the future has that, just keep this in the back of your mind and reach out, check with a chiropractor. If you're not in my area, check, just go on Yelp, go on Google and check and find somebody and get that checked. So have a great week, and we'll see you next week.